Information and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency. We are servicing Miami-Dade, Broward, and Palm Beach County. You can reach us directly at 954-717-7027. I am your host, Louise Gomez, and I'd like to welcome to the show today we have Dr. Bradley Taylor. He is the Chief of Cardiac Surgery right here with Baptist Health in South Florida. Welcome to the show, Dr. Taylor.
Thank you very much, Louise.
Yeah, we're excited to have you and learn a little bit more about what's going on and what's new with Baptist Health. And maybe you can start out by telling us a little bit about your background and what drew you to the field of cardiac surgery.
Yeah, I actually became interested in medicine when I was a high school student.
Okay.
I was 16 years old. Education had kind of been a priority of my family, and it wasn't until I took a human biology course and had a particular teacher that it kind of inspired me.
I love that.
And so through college and that time period, I started focusing on and getting experiences working in hospitals and working with patients. I wanted to become a cardiac surgeon because first of all, I identified with the surgeons as a group. It seemed like more like an athletic endeavor, and I liked the team aspect of it. Mm-hmm. And I always was just fascinated with cardiac physiology, and I wanted to have the opportunity to operate on the heart because I thought the heart surgeons, whenever the chips were down and a patient was really in trouble and everyone was kind of expended their knowledge base or ability to rescue a patient, you could call a cardiac surgeon and they could step in and be able to rescue the patient because they understood the cardiac physiology. They had the tools at hand to be able to pull someone out of trouble. And I wanted that.
I love the story, and I love the fact that you had a teacher who impacted you.
Yeah.
It's so important that people follow their hunch, their intuition, and I'm so happy that teacher was there to do that for you. So Dr. Taylor, what types of cardiac procedures do you specialize in, and what can patients expect from these types of treatments?
Sure. So personally, I perform really the full gamut of cardiac surgery. I spent the last 25 years, 30 years doing cardiac surgery and have had experiences for everything from transplant to coronary bypass grafting. I've worked in some really fantastic locations, both in Europe and in the United States, and trained specifically to do minimally invasive mitral valve surgery. I've done a lot of coronary artery bypass grafting. In the last 12 years, I developed a big aortic center at my previous place of employment, and we did a lot of dissection work and aneurysm work. Patients that have diseases of the aorta in the central chest and their descending aorta. We built a large aortic center that really became a reference center for that part of the country. And through that, we're able to do a lot of innovative things. We had a program, what we called operating on the inoperable. There are a lot of patients who are perceived to be too high risk to have surgery.
Okay.
But with technology and innovations now, we can do things in a much less invasive way or less impactful way, particularly by putting in stent graft technology, accessing the peripheral vasculature and over a wire, be able to take care of pathologies or disease states in their descending aorta or ascending aorta. and was really proud of that because in many respects, what we do in the operating room is not that difficult compared to controlling the response of the operation that people undergo. What happens to patients after they've had heart surgery or any big surgery, it's a traumatic event and the genetic code gets turned on. And it's almost like, it can be like opening Pandora's box.
Oh, I see.
So being able to ameliorate that, almost doing some of the biggest operations we do to humans and doing it in a way that is very less impactful.
Wow, that sounds quite an endeavor. Tell us about how Baptist Health's cardiac surgery program kind of stands out in terms of technology, patient care, or outcomes, especially that you have so much experience. You've been to Europe, you've been to so many different locations. What stands out about Baptist Health for you?
Well, first and foremost, what really attracted me to Baptist was the culture of the people I was meeting at Baptist. This is a very patient-centric organization from the top all the way to everybody that you meet. And they're really focused on specific, the patient and the patient experience. And I wanted to be part of something like that. I also think there's a big opportunity to change the way healthcare is delivered from a cardiovascular standpoint in this part of the United States. There are so many people moving to this region, and most of the people moving to this region are going to have cardiovascular issues. And to be honest with you, it's such a beautiful place. Baptist also is investing in cardiac surgery. So there's a lot of things that we're going to start bringing to the region that is new and innovative that hasn't been offered before. And so I'm very excited about that. And to be in a place that has a fresh eye on heart surgery, to me, it's what brought me here.
Dr. Taylor, is cardiovascular disease one of the top diseases that we have here in the United States? Is it like number one or two?
It's the number one.
It is the number one, unfortunately?
Yeah.
Okay.
So it's the number one reason why people exit this planet is because of a cardiovascular issue. Coronary bypass grafting is the most common operation done worldwide. It's still the number one operation done in the United States. And being able to take somebody who's has a lot of life left in them and revascularize their heart so they can continue to do things, have more birthdays, anniversaries, time with their grandchildren. To me, there's nothing more rewarding.
I love that. How much of these different cardiovascular diseases are genetic? Are we getting them from our parents, grandparents? I know you probably get that all the time, but what do you?
Yeah, no, that's a great question. So I think of it this way. We become our parents. We have the same genes, they were shared with us. And if you think about it, if you look in the mirror, we all start to look and behave very similar to our parents. And so similar to that, we get the same disease states that our parents and our relatives had because it's in our genetic code. So, it's really important to pay attention to your family history, to relay what your family history is, because there's a very high likelihood that you're going to develop the same issues or the same problems at about the same time.
Wow.
Now, that's on top of that, we can do things to exacerbate our, what's being expressed by our genes, and that includes, smoking, drinking too much, not exercising, eating poorly, things along those lines. They contribute to it. Diabetes, that's really out of some of our control. So things along those lines.
So, Dr. Taylor, what does the pre- and post-surgical care journey look like for patients under your care? I'm sure there's people listening and they want to know.
So again, one of the things that really attracted me to Baptist was there's a team mindset here, and that what we've developed here at Baptist and what Baptist has in place is really a team of veterans, is the best way to put it. The nursing staff, the people who are actually, at the bedside managing the patients, they've been doing it for a very long time. Some up to 25 years. I've been really impressed, both at the Bethesda East campus and at the Boca Regional campus. And the people who assist us in the operating room, the people who manage the operating room, they're all seasoned veterans. So when you have that, you have people that have been there, they've seen it before, and they're prepared to take care of patients at a very high level. There's also a customer service aspect to the care that's being delivered at Baptist, which I think is really remarkable. The facilities that they provide are beautiful facilities. When you interact with the staff, they're kind, they're friendly people, and when you faced with, and I'll be the same way, when I'm faced with having to have heart surgery or anything, it's daunting, right? Yeah. And you want to be in a place where people are ready to receive you, that want to take you through that journey to the best that that it becomes. I'm not going to say it's a pleasant experience, but one that you're comfortable to many levels, and then you can look back on it and say, I was taken care of at a very high level. My needs were met. My family members were met, and I can speak to the people I work with. They're very focused on making sure that I talk to families. I meet with families either early in the morning or late in the evening, because it's not just about the patients, but the families impacted at a significant level, and we want to take care of the whole family as a whole.
I love that. Everything adds up. It sounds like you're doing the whole gamut. You, the team, everybody's playing their role and their part to make it an experience where it can be, a pleasant experience under, considering the circumstances.
That's right.
So we appreciate you and the team for doing that, definitely. Dr. Taylor, so what excites you the most about being on the Baptist Health team, and what do you want your future patients to know about you? Because we probably have people listening right now, and they're probably thinking, oh my God, I have to send my mom, or, so what do you want your future patients?
So I think the biggest thing that I want people to know is that this is a really important relationship, and we're going to take the time to talk to patients and their families. Okay. Part of my job is to provide an education so they can make the decision that's best for them. And oftentimes I hear patients, they don't get a lot of time to talk to the physician or along those lines.
I hear that all the time.
Yeah. So I like to sit and talk to patients. My team likes to sit and talk to patients and provide educations, because the circumstances and the decisions that patients have to make, their circumstances are different. This isn't, it's not, not every patient's the same, not everything. And there are options. And so we want to help people make decisions, choose options that work best for them, and make it about them, not about us.
I like that, because there's so many different options, and what maybe we perceive to be the right one for them.
That's right.
And, maybe it's not.
That's right.
So I'm sure you have a lot of experience with different patients having that.
Oftentimes when, our role goes from being somebody, taking care of patients, is actually becoming a facilitator, right? So someone will, will be requested to evaluate somebody and say, that's not really actually what I want to go to, but part of my job then is to facilitate getting them to the next place or the next person or the next option. And we're happy to do that.
I like that. You're giving them the option to make really the best decision for them, and you're just sharing, you're facilitating, so you're sharing your knowledge for them to make the best decision. Yeah, that's great that you guys are doing that. And so what makes Baptist Health cardiac surgery program one of the leading centers in the region? Because I know there's different
there's
cardiac,
lots of options.
right?
Yeah, there's lots of options here. I think a couple of things. One is, I come from a very innovative space, and we can design operations for people that are different because of that innovative space I've come from before. We also want to be in a position where we offer the full gamut of cardiac surgery, and whether somebody presents with in an emergency state or an elective state, be able to manage them. A lot of times if somebody comes in an emergency, we want to turn that emergency into a completely elective position. So those are some of the things. Obviously we're going to do, we can provide, you name the issue or problem, whether it's related to their coronary arteries, their valve. We can oftentimes do their operations through smaller incisions. As I said earlier, in the aortic space, oftentimes we have to do open arch surgery or open ascending surgery, but now we have tools and techniques. I'm going to be the national PI for a early feasibility trial for a 3-branch graft. It'll be the first 3-branch graft offered in the United States. So there's a lot of things that we're going to be able to offer. We have access to surgical robots, things along those lines. So,
wow.
And then the other thing is what we're developing here isn't just about having, it's about having a team of surgeons. So we have an excellent group of surgeons that work with us. We're looking to bring, I have a lot of people reaching out now that I'm here.
Nice.
They want to join us. So we're going to bring in some real experts and start to develop. Ultimately, I would like both Bethesda East and Boca Regional, Palm Beach County, to be a destination.
We have a quick commercial break. I am so sorry. We're going to continue this conversation.
Perfect.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, everybody. We have Dr. Bradley Taylor. We are discussing all things cardiac surgery. He is the chief of cardiac surgery right here in Baptist Health. And actually, let me give you the number out. It's 561-955-6300. Dr. Taylor, we were discussing before that commercial break some of the advanced technologies. You mentioned robots and different things, and also what are some of the minimally invasive techniques? We can touch on that again.
Yeah. So when you think about coronary artery bypass grafting, in particular, there's an artery that runs on the surface of the heart called the LAD. It's very close to your chest wall, and there's an artery that's very close to that runs along the chest wall called the left internal mammary artery. Through a small incision just below your breast line, you can make a small incision, take down, with a robot or without a robot, take down the lima. And then because those two arteries are very close together, you can do a hand-sewn anastomosis. And so not everybody has to have their chest open for bypass surgery.
Okay.
And you can graft that, and in conjunction with a cardiologist, do what's called a hybrid procedure where they stent the non-LAD portions of the heart. In addition, for valvular, whether it's an aortic valve, mitral valve, we can make small incisions, not have to go through the center of the chest, and then repair or replace valves, whether it's the aortic valve, the mitral valve, through a small incision. One of the things that's really important, particularly for young people, is they want to have their valves repaired, whether it's their mitral valve or their aortic valve. There are techniques that we're very good at now at repairing the valve. When I was a younger person 25 years ago, only about 30% of mitral valves were repaired. Now 95% of mitral valves are repaired.
That's impressive.
And it's very similar now with aortic valves. We can repair many of the aortic valves, particularly if they have AI. And then when it comes to the aortic space, not everybody has to have a full open operation to fix their aortic pathology. I would say probably about 15% of patients would qualify overall. In the descending space, the majority of descending operations now are endovascular, and and that technology has been out for about 18 years in the United States, and so we have a lot of experience with that. And then, of course, can't not talk about transcatheter aortic valve, which is a way to replace the aortic valve now, just through basically a needle stick in the groin.
Wow.
And put a new valve in. In a single cardiac cycle, somebody goes from a very stenotic valve, the heart having to do a lot of work, to a wide open aortic valve that functions normally, and they go in a single cardiac cycle. In many of these patients, they almost look gray or blue, and they pink up immediately.
Wow.
So it's pretty fascinating.
It's so impressive to hear about the evolution of it when you're talking about like 25 years ago and what it is now. So Dr. Taylor, people are listening right now and they're thinking, oh my goodness, what can I do at home to really ensure that I have the best cardiac health?
Sure.
Like, what can I do?
Yeah. So obviously, I would say most people want to avoid meeting a cardiac surgeon unless they absolutely need to, right?
Sure.
And I understand that. Most of us probably spend more time paying attention to the maintenance of our car or our home,
Good point.
you know, as opposed to
Good
ourselves. So, but there are lots of things we can do, right? And so, and they're all common sense things that we've been taught a long time ago. I think about, you know, I used to hear, you know, you are what you eat, right?
Yes.
So it's important that, you know, we eat better quality food.
Sure.
And I like to think about it this way, you know, we want to eat food that's produced as opposed to manufactured, I think is the easiest way to think about it. So things that are grown in a garden or on a farm, right? Fruits and vegetables. We want to eat healthy meat. Fish is a great thing, right? And here in Florida, we have access to, I think, you know, some of the best fish in the world. And so you want to balance it that way. And then exercise, right? And types of exercise, you should exercise half an hour a day, 5 days a week at a minimum. And that exercise should vary, right? From walking, if you still want to jump rope, you can jump rope, play tennis. Tennis is probably the best exercise.
Nice.
And there are lots of studies that tennis players live several years longer than non-tennis players. Running, even Pilates or you know, playing pickleball, which
that's a big
become
thing
very
here
popular,
now.
right? So that type of activity. The other aspect is you think about the heart's always identified as an emotional organ, right?
Yes.
We think of, right? So having a social life, right? Being in contact with people, interacting with other humans, you know, and not being sad and lonely or being, you know, shut into your home. That's what I think is so great about here in Florida. You can get outside, you can walk, you can meet people, you can socially interact.
That's right.
So that's really important. And then obviously the things like smoking.
Right.
Smoking, we know, poisons us. But it doesn't matter what you smoke; it's all bad.
Right.
Limit your alcohol intake. Right. You want to. It's okay to drink, but certainly in moderation. Maybe a glass of wine, cocktail every now and then. But if you're drinking in excess, it actually damages not only your heart cells, but also other cells in the body. Yeah, I think those are the key things.
I think you mentioned something about a calcium test. What is that about?
Yeah. So there's access to a CT scan now called a calcium scored CT scan.
Okay.
And it's a great screening test. You know, you get a nice picture of what you look like on the inside.
Okay.
And for men of about 40 years, once they reach about 40 years of age, without risk factors. If you have risk factors like diabetes, you smoke, positive family history, you should probably get it around the age of 37.
Oh, wow.
And it's a snapshot that takes a look at the amount of calcium that's in your coronary arteries and is a high predictor of whether you'll have a cardiovascular problem. Women are a little bit different, and this is kind of one of these things that's interesting and or it's controversial, and it's starting to change. People are getting a different perspective. The guidelines suggest that women at 58 should get a calcium score, so 18 years later than men. And if they have risk factors, you move that down to around 52.
Okay.
But if you think about it, the discussion is that calcium gets distributed differently. I actually think that women probably should get it younger or at an earlier age, and it's not an expensive test. It's a good way to be evaluated, and then it gives you and your doctor peace of mind.
That's good to know.
And it is a good predictor of whether you need to go to the next step. And we see a lot of patients who get referred to us who were simply, their wife gave it to them as a birthday present or as some way to say, you know, I'm worried about you and I think you should get screened. They get screened and they find out they actually have coronary disease, and then they are either intervened upon by a cardiologist or by us in heart surgery. I think it's a fantastic test, and it's a way that, again, if people become more responsible and have more insight into their own health, and are certainly paying attention to that. Simple things like, we've all learned that, we're supposed to floss and brush our teeth.
That's right.
Well, get a blood pressure cuff
right.
and put it right next to your on your sink, and when you go get up in the morning, check your blood pressure in the evening, and if you write it down, you become more responsible for your own health care. Paying attention to symptoms. Symptoms for all of us are a sign that you're late in our body's ability to compensate for whatever situation they may have. And we as people have an unbelievable ability to compensate for whatever pathology or disease state we may have. So if you're short of breath, if going up, most people don't have flight of stairs here, but if you exert yourself and you're finding yourself short of breath, being short of breath is non-normal, and you should be evaluated. And certainly if you have chest pain, acute onset of chest pain, or chest pain when you exercise that radiates to your arm or into your jaw, you need to be evaluated immediately.
Wow. Such valuable information. I can't believe the time has already flown by. We literally have 1 minute left. So we appreciate that call to action, so people can go to their family physician and request the that CT scan, the calcium test.
Okay. Perfect.
What else would you like to share? The last 30 seconds.
Well, I'm very excited to be here in Palm Beach County.
Thank you.
I think this is a beautiful place to live. I've only been here a month, but I've met so many fantastic people, and it's been really, I really look forward to serving people in this community.
Well, we feel lucky to have you. Thank you so much. It's been a pleasure.
Yeah, thank you.
Thank you so much, Dr. Taylor.
Thanks.
Take care.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.